regular rounds of the various areas and the various bad practices also that that is being done. So all have to avoid this. All the healthcare workers, irrespective whether it's a resident, whether it's a consultant, whether it's a nursing officer or a security officer or HE or HK, all have to comply to the do's, not don'ts. So I would request our senior resident, Dr. Shashi, she will take over, and in between our various ICNs, they will be coming, and if you all have any doubt during any time, you can always be free to ask.
Good morning to all seniors and my colleagues. Today I'll be presenting about infection control practices. So we all know hospital-acquired infection as broadly divided into 4: COTI, CLABSI, ventilator-associated events, and surgical site infections. So the main reason or the most common mode of transmission for these infections are hands of the healthcare workers. So to prevent these infections, we should perform adequate and effective hand hygiene. So what are the do's of hand hygiene? So there are 5 moments of hand hygiene. Those are before touching the patient, after touching the patient, before performing any aseptic procedure, after performing aseptic procedure, after body fluid exposure, and after touching the patient's surroundings, like when you're touching the file, monitor. So you need to perform hand rub or hand hygiene. So these are the indications for performing hand hygiene. Whenever you get an opportunity among the 5 moments, during the routine clinical rounds or when handling the patients, when there are no facility for hand wash, you can perform hand rub. And when the hands are not visibly dirty, if the hands are visibly dirty or visibly soiled with blood, body fluids or glove powder, you are supposed to perform hand wash. And then handling patients with diarrhea, you need to perform hand wash, not hand rub. Then after using washroom and before handling the medications. Surgical hand scrub is performed prior to any surgical procedures. So for hand rub and hand wash, we use a volume of 3 to 5 ml and perform 30 seconds in case of hand rub, and we perform it for 60 seconds for hand wash. Then this is an image showing the frequently missed areas when we perform hand rub or hand wash. So the red one indicates the most frequently missed areas. They are the fingertips, the thumb, and the web spaces. So when we perform hand rub or hand wash, we need to focus more on these tips. So even after performing hand wash or hand rub, these are the areas which has been missed. Please concentrate on fingertips, thumb, and the web spaces. How to perform hand rub? So our ICN Ms. Komal will demonstrate how to perform hand rub.
Before hand hygiene, we know our hand is totally free.
We should remove all the rings, bracelet, the threads. There should be no ornaments in the hands.
Don't wear any nails should be clear, and don't wear any thread in your hand and watches, etc. तो पहले तो हमें एल्बोस हमेशा हाथ से खुले रखिए ताकि हम हैंड हाइजीन प्रॉपर्ली कर सकें। तो हाथ भी हमारे पूरे तरीके से विदाउट थ्रेड होने चाहिए, रिंग्स नहीं होनी चाहिए और नेल्स कट होने चाहिए, ठीक है। तो दिस इज द प्रोसेस। एंड एडिटिंग टू थिंग्स आल्सो इज देयर। व्हाई वी नीड टू डू हैंड हाइजीन? प्लीज कोई भी बोल सकता है, कोई भी आंसर कर सकता है। व्हाई वी नीड टू डू हैंड हाइजीन? एनी आंसर प्लीज?
Any answer?
Yes. To prevent cross infection. Thank you. And how to do hand wash and hand rub? Why we need to do hand rub and hand wash? What is the difference between both of them? Yes.
If our hands are visibly soiled, so we have to do hand washing, and
yes.
if it's not, then
and we can do the hand rub. Thank you सोनिया मैम. सोनिया मैम ने बिल्कुल इजी तरीके में बताया. अगर हमारे हाथ देखने में गंदे या विजिबली डर्टी है तो हम क्या करेंगे? हैंड, प्लीज बोल सकते हैं लाउडली, हैंड वॉश. अगर हमारे हाथ देखने में गंदे नहीं है, जस्ट हमने फाइल टच किया या हमने पेशेंट को क्लोज से ही ऐसे टच करके देखा, तो हमें क्या करना है? हैंड रब. तो आई एम शोइंग हाउ टू डू हैंड रब. So first of all, we will take hand rub, palm full, according to your hand. First step, please सब अपने हाथ आगे कर लीजिए. सब लोग आगे कर लीजिए. Imagine कीजिए आपके हाथ में hand rub है. तो सबसे पहला स्टेप होगा हमारा palm to palm. So start 1, 2, 3, 4, 5. After that, palm to dorsum. We'll interlace with finger. 1, 2, 3, 4, 5. Vice versa. 1, 2, 3, 4, 5. And next, palm को close कीजिए. ठीक है, हम उसके ऐसे करते नहीं. पहले palm with interlacing with finger. 1, 2, 3. कर देते 1, 2, 3, 4, 5. After that, interlock with finger. 1, 2, 3, 4, 5. हम रोटेशन कैसे करेंगे? एक थंब को ऐसे करेंगे और दूसरा थंब उसके ऊपर ओवर करेंगे. शो मी योर थंब रोटेशन. प्लीज लिफ्ट योर हैंड like this. 1, 2, 3, 4, 5. Another hand also. 1, 2, 3, 4, 5. Next step. Tip of finger clockwise and anti-clockwise. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Another hand. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And like safe. ठीक है? It's dry your hand. कोविड में हमने एक स्टेप ऐड किया था. कौन सा? रिस्ट वाला. वो अभी नहीं करना है. अभी हम सिर्फ यहीं तक करेंगे. ओके, तो किस को हैंड हाइजीन करना आ गया? हैंड रब. लिफ्ट योर हैंड.
डेमो करके
तो हम सब खड़े हो जाएंगे अपनी सीट्स पे. सॉरी टू इंटरप्टिंग यू. प्लीज आप सब खड़े हो जाइए. या कोई दो लोग
डेमो करके दिखा.
कोई एसआर में से, कोई जेआर में से, एसएनओ में से और एमओ में से, 4 कैटेगरी में से प्लीज कोई एक आगे आ जाइए. एंड सेक्रेटरी आल्सो प्लीज जल्दी से वॉलंटियरली आ जाइए सर. यस सर. सर प्लीज कम. एसएनओ एंड एनओ प्लीज कोई भी एक सर आ जाइए. प्लीज और भी कोई आ सकते हैं, आना चाहते हैं तो आ सकते हैं. हम और खड़े हो जाएंगे तो अच्छा लगेगा और थोड़ा इंटरेक्टिव रहेगा. प्लीज आप और हम लोग लाउडली बोलेंगे. व्हाई वी आर काउंटिंग 1, 2, 3, 4, 5 बिकॉज़ duration of hand rubbing is 20 to 30. Sorry, I 20 और 20. तो ये मैंने सिर्फ पूछा ताकि आपको याद हो जाए.
और how much hand rub to be used? Amount of the hand rub to be used. Very good.
So आप लोग इधर से सीधे आपके हाथ में हैंड रब है. ओके, स्टार्ट. हम 1, 2, 3 काउंट करेंगे. ठीक है? 1, 2, 3, 4, 5. वाइस वर्सा. 1, 2, 3, 4, 5. अदर हैंड. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Tip of finger. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Try your hand. Happy? And thank you so much for this.
Thank you, Ms. Komal. So this is a video showing where the hand hygiene opportunities are missed. Here the healthcare worker is seeing the patient, looking for the file.
So what was missed in this video? Yes, after the touching the patient, what should have been done? Hand of discuss, yeah. So that is what this is happening. Like this is a real case scenario what we are trying to take, and this should not be done. These things like should be avoided so as to eliminate the cross infection, which is especially common in especially in the cases of like HDU or ICU cases, ICU wards.
So what is wrong in this? There are 4 images.
Yes, anyone? Image 1. What's wrong in image 1? Huh? Image 1. What is there? Apart from that? Yes, gloved hand. And the second one, image second? Okay, gloved hands documentation. And the third picture, what is it? Yes, and the fourth one? Ornament along with the threads. So ideally what you are doing, like the patient, the healthcare professional, in the first figure, what he's seeing the patient, examining the patient with the gloved hand. So ideally, like what the healthcare professional will think that I'm safe. मुझे कुछ नहीं होगा, मैंने ग्लव्स डाल रखा है. So he will avoid using this hand rub. So immediately after examining this first patient, he will go to the another patient without performing hand hygiene. तो उसके कारण क्या हो सकता है? उसकी infection आप दूसरे में transfer कर सकते हो, cross infection हो सकता है. Similar with that second वाले picture में, वो patient को सब आप सोचो कि वो healthcare professional ने उसे examine किया और वो फिर जाके बैठ के वो PhD इसकी चार्ट पे लिख रहा है. तो थर्ड पर्सन कोई आएगा, नॉर्मल पर्सन अगर मान लो इन्फेक्टेड है, तो वो तो नॉर्मल बेयर हैंड से वो अपना हिस्ट्री शीट वो देखेगा, तो वो हो सकता है ट्रांसमिट करे इन्फेक्शन. तो these things should be avoided.
So these are the do's of hand hygiene. So whenever in your ward area, if you have the sink or the wash basin or the scrub area, please perform hand wash. Then also utilize the hand rub in your area. Just think safe, work safe and be safe. Do's and don'ts of cough etiquette and personal protective equipment. Respiratory etiquette. Use tissue paper or the hand key. When you cough, please cough with the tissue paper or hand key and then discard the tissue paper. Then wash your hands thoroughly and then wear a mask. So this is how we have to perform the cough etiquette. Personal protective equipment. These are the specialized clothing or equipment worn by the employee or healthcare worker for protecting against infectious agents. So the goal is to improve the patient personal safety in the healthcare environment by using the PPEs. We'll see what are the PPEs: cap, gloves, gown, apron or the bodysuit, mask and the respirators, goggles, face shield and shoe cover. So this is the donning and doffing procedure. The video is available in our website. So first we wear the shoe cover, perform hand hygiene, and then we wear the first pair of gloves, then we wear the gown, N95 mask, head cap, face shield, and then the plastic sheet. Then you wear the second pair of gloves, and then you are safe. Doffing will be in the reverse order. First, this will be supervised by the supervisor. We perform hand hygiene. After every step, remove the plastic sheet, perform hand hygiene, and then remove the outer glove, remove the face shield, head cover, gloves, shoe cover, perform hand hygiene, and then remove the mask, and then you can leave the area.
Like with COVID, I think so. Everyone must be an expert in donning and doffing. You must have done, donning and doffing several times. Like in a day, twice or thrice daily, you must have been doing. And these are the don'ts. What you see, just like what we suggest generally during the doffing. After doffing, you need to wrap it up nicely, and so as to the bin occupy very less space. Even if it's wrapped properly and if it's kept inside the bin properly, it will occupy less space. What we got to see these things like in the ward, like simply and running away. So you can see the like garbage, like heaps of garbage is being piled up in the various areas. And like biomedical based team, they had they had to put a great efforts in order to make them proper, the rooms make them proper. So ये व्यू नहीं होना चाहिए इस तरह का, क्योंकि ये हार्डली आपको जैसे आप जब डॉफ करते हो आपको ज्यादा टाइम नहीं लगता उसको रैप करने के लिए. सो प्रॉपर रैप करके आप ये इसमें बिन्स में रख दोगे तो फिर कोई दिक्कत नहीं होगी. स्पेस भी कम लगेगा, इट विल बी नीट ऑल्सो, एंड मोरओवर जो इन्फेक्टेड है इन्फेक्शन की चांसेस भी कम हो जाएंगे. तो इट्स ऑलवेज बेटर टू प्रॉपर रैप इट एंड डिस्कार्ड.
So now coming to the mask, the do's are use when you step out, like according to the instructions, use appropriate. And after wearing the mask, do air fit test, and then mask may be a standard or homemade washable mask, and perform hand hygiene if you are touching the front of the mask. And then these are don'ts. Do not touch the mask in the front. If you are touching, perform hand hygiene, or do not hang on the chin or on the collar or the neck. Do not hang the mask around the collar. So what type of PPE we will choose? So for any suction procedures, we use glove, mask, goggle or face shield to avoid the splashes. In emergency, any wounded patients wear all the PPE, glove, mask, gown, cap, face shield. Phlebotomy, just wear gloves. Cleaning an incontinent patient with the diarrhea, wear gloves, mask and gown. Irrigating a wound, wear all the PPE, gloves, mask, gown, cap, goggle, face shield. And for taking vitals, you don't need any PPE. So coming to the gloves, the do's are before doing any procedures or before touching any mucous membrane or non-intact skin, remove the gloves after carrying the patient. Do not wear the same gloves for more than one patient. There could be a chance of cross infection. Do not reuse or wash the gloves. Perform hand hygiene after removing the gloves. The don'ts are for taking vitals, there is no need of gloves. Do not use gloves for performing subcutaneous or intramuscular injections. Don't use gloves for bathing or dressing the patients. For eye care and ear care, don't use gloves if there is no any secretions. And any vascular line manipulation in the absence of blood leakage, do not use gloves. Do not use gloves even if you are handling the files. So next will be biomedical waste management, do's and don'ts. This will be presented by our infection control nurse, Ms. Shalini.
Good morning to all. Today I am here to present the topic biomedical waste management and needle stick injury. As you all know about the biomedical waste management, how to manage the biomedical waste. And biomedical waste management is the major part of the infection control practices. If we dispose the biomedical waste properly, we can prevent the spread of the infections. In the next slide, there are some pictures collected from our hospital from the different areas. In this, in red bin, there is a mixing of bottles, NS syringes and infected tubing, plastic tubing. And vials. There is a wrong practices seen in many areas where mixing of the BMW. All the healthcare workers knows about how to dispose the biomedical waste, but you have to think before disposing the waste to prevent the spread of infections. In these pictures, there is a blood transfusion bag discarded in blue bin. If anyone tells about blood transfusion bag, where to discard the blood transfusion bag in your area? Yellow bin. There is an exceptional case, all the infected plastic discarded in the red bin. But blood transfusion bag is a non-chlorinated bag disposed in the yellow bins.
So what might be the reason of the mixing? Anyone? In this first, second, third or fourth last picture, what might be the reason? Anyone? Yes? Lack of knowledge. Everyone scored full marks in auspices, whatever we are doing in the infection control, this thing. Everyone has sound knowledge regarding this. So you cannot say that you have lack of knowledge. Because everyone scored, 100%, 10 on 10 in the auspices. So what other might be the reason? Patient attendant won't be discarding the syringes or fluid bottle. Yes? नहीं, lack of awareness also you cannot rule it out. Like because OSPI में आप लोग तो बहुत अच्छा जवाब देते हैं. 10% आता है, 10 out of 10 आते हैं आपका भी infection control के. Yes. One is the hurry और लापरवाही. हाँ ठीक है, लापरवाही है. तो ये लापरवाही नहीं होनी चाहिए, ये लापरवाही बरतनी नहीं चाहिए, क्योंकि ये क्या होता है कि कभी कभी नीडल्स आते हैं, जो BMW वाले आते हैं उनको नीडल स्टिक हो जाती है, हमें पता नहीं होता है, अननोन नीडल है, whether it's HIV पॉजिटिव, हेपेटाइटिस बी पॉजिटिव पेशेंट पे यूज किया है या HCV पॉजिटिव पेशेंट पे यूज किया है, तो हो सकता है उनके चांसेस ज्यादा होंगे. अगर पिक हो गया तो कितने सारे नीडल स्टिक इंजरी पिक होते हैं और हमारे यहाँ आते हैं फॉर द डिस्ट्रिक्ट काउंसलिंग. हाँ बताओ, बताइए. हाँ
वहीं पे बैठ के छोड़ के चला जाएगा, ठीक है, उसको वहीं पे छोड़ के चला जाएगा. मॉर्निंग में ऐसे आएंगे, वो सभी जगह से कलेक्ट करेंगे, डिस्कार्ड करेंगे, तो जल्दीबाजी में वो इधर उधर डाल देते हैं. तो मोस्टली क्या है कि जो मेजोरिटी है वो स्टाफ मतलब कि छोड़ देता है काम करके वहीं पे, एक पेशेंट का दूसरे पेशेंट के पास में वहीं पे, तो ऐसे आकर के उसको फेंकेगा तो वो इधर उधर फेंकेगा. सर डेफिनेटली उसको इतना नॉलेज नहीं है कि वो डेली पर, लेकिन उसको ये मिस्टेक कर देता है और स्टाफ भी कई बार ऐसा करता है. ऐसा नहीं कि स्टाफ ही करता, डॉक्टर भी करके जाते हैं. हाँ वो भी करके जाते हैं, उनको मालूम रहता है कि इसमें डालना है, लेकिन वो डालेंगे नहीं पैकेट. तो यार ये तो गलती हो गई यार मेरे से, तुम फेंकवा दो, मैं अच्छे से करवा दो इसको, ऐसे ठीक नहीं.
Absolutely right है. It's not only मैंने इसीलिए हेल्थ केयर प्रोफेशनल बोला, उसमें रेसिडेंट भी आते हैं, कंसल्टेंट भी आते हैं, सारे कोई आते हैं इसमें. तो इसीलिए ये लापरवाही ये नहीं होनी चाहिए. और कभी कभी राउंड्स में हम लोग जाते हैं तो साइड में देखते हैं कि बीपी ब्लेड रखा हुआ है, कभी नीडल्स ऐसे रखे हुए हैं. तो उसमें क्या होता है कि HAH के स्टाफ आते हैं क्लीन करने के लिए, या कभी वो नीचे गिर जाता है, कुछ तो क्लीन उठा के अच्छे से कर लेते हैं, कोई नीचे गिर जाता है, कोई चलता है उस पे, उससे फ्रिक हो जाती है. और कभी कभी जब राखी मैम को पता होगा, लाइक वी हैड अ नीडल स्टिक इंजरी among the nursing students, बहुत ज्यादा. Immediately after COVID, there were like around 15 BSc final year students post COVID वो लोग आए थे. उनको like after 6 months है ना शायद, after 6 months they came and they went into the ward, and I then daily we used to have pricks around 15-16 pricks हुए थे BSc nursing final year students को. First year also, yes. तो फिर हम लोगों ने उनकी क्लास जाके ली, उनको बताया गया, they didn't have any awareness also, and even we instructed the to the nursing also, like उनको आप अभी just train them and not उनको सीधा front field में आप उनको ये नहीं करो. So उसके बाद the incidence of the needle stick injury came down, especially among the students. तो इसीलिए ये चीज लापरवाही हमें नहीं होना चाहिए. हमें प्रॉपर उसके वेस्ट कंटेनर, अगर ठीक है देयर आर सम इश्यूज, लॉजिस्टिक इश्यूज हैं कि शार्प कंटेनर्स है नहीं, लेकिन शार्प कंटेनर्स को तो बनाया भी जा सकता है. जो कैनिस्टर है 5 लीटर वाले, उसको काट के भी तो बनाया जा सकता है जब तक कि अवेलेबल नहीं है. तो दीज थिंग्स कैन बी डन. दीज स्मॉल थिंग्स इट विल मेक अ चेंज.
Sir, this is a protocol. The person who is generating the waste should be responsible for disposing the waste. The mixing is preventing by this thing only. There are some do's and don'ts for the biomedical waste management. Discard biomedical waste management in the particular bins and foot operated bins is used. Label BMW poster. Hand over the waste after 2/3 of fill. Put the barcode label at the points of generations. Document weight of waste, area code, timing, etc. And don'ts. Don't mix BMW with general waste. Don't overfill the waste bin. Don't discard sharp item in the other waste bin. Don't put the BMW at the patient bedside and dressing trolley. Don't discard liquid waste in the BMW. In the other area where the cytotoxic drug is used, different cytotoxic label bin should be placed in areas for discarding the chemotherapeutic drugs like expiry medicine. Where to discard the expiry medicines? Okay, expiry medicine should be discarded in the yellow bins. Next is a needle stick injury. The incidence of needle stick injury is increased from last few months. The prevention of the needle stick injury is important because most of the healthcare workers got the needle stick injury from unknown patient's viral marker. There are some do's of the needle stick injuries. Keep the shafts visible and avoid distractions. Never hands off or leaves the needles or shafts of others to dispose. The person who is using the shaft should be responsible to discard the shafts in the shaft container. Maintain a safe zone around the shaft and store shaft container out of the reach of others not needing to access. Be aware of staff nearby and secure used shaft container during transport to prevent the spilling. Follow standard precautions, infection preventions and general hygiene practices consistently. Participate in your employer's blood-borne pathogens training program and report any needle stick and other shaft injury immediately to your employer. I would like to ask, when the needle stick injuries happens in your area, what you have to do?
Anyone? What happens if you have a needle stick injury? किसी को अगर needle चुभ जाता है तो क्या करना होता है? Squeeze नहीं करना होता है. और क्या करना होता है?
We have to wash it under running water.
Okay. And after that?
We have to inform the ICN.
Okay, directly ICN. If ICN is not there, then
On duty JR.
on duty JR.
Infection control JR.
Okay, if no one is there, then
Then we have to inform our supervisor.
yes, immediately like you have to inform your SNO depending upon, and then after that there is a nodal officer also. Do you all know? You have a nodal officer for needle stick injury. So you need to inform. Next day or immediately you have to go to the
Nodal officer. Emergency department.
Sir, I would like to explain next. Use needle cutter or destroyer for discarding the needles. Needle cutter is used to destroying the needles for prevention of the needle stick injuries. Use puncture-proof or disposable bin for handling the shafts. Shaft container is used for disposing the shafts. If the shaft container is not available in the area, we can use the transparent can for disposing the shafts. But for the large shafts like the biopsy needles, we cannot use this shaft container because different shaft container or big open mouth shaft container should be used. In many areas that we can see that all the biopsy needles should be placed in the small shaft container, and there is a chances of the needle stick injury. Separate shafts from other base. Don'ts of the NSI. When the patients got healthcare workers got needle stick injury, avoid using needles whenever safe and effective alternatives are available, and avoid recapping or bending needles that might be contaminated. It is important to prevent the needle stick injury. Recapping is avoided. A plan for the safe handling and disposal of the needles before use, and don't empty, handle or transfer used shaft between containers. Do not recap before disposable, and don't discard the shafts in bin which are open and with wide mouth. There are pictures collected from the different areas. First pictures with needles and gauze pieces. The procedure is done by any healthcare workers and left on the trolley. there is a chances of the needle stick injury. That's why I'm explaining the protocols for discarding the biomedical waste management. The person who is generating the waste should be responsible for discarding the waste. You have to communicate between all the healthcare workers in your area, nursing officer or other residents regarding the biomedical waste management protocol. Surgical blade is on the trolleys and all the needles left on the floor. And the last picture is about the biopsy needles or some others used for the procedure. Do not use the same sharp container for these because sharp container is small and filled with these needles easily. So you can use other different containers for these needles. Management of the exposed person. If the needle stick injuries happen to any staff, then first remove the gloves if appropriate and wash the exposed side thoroughly with running water and irrigate with water or saline if eyes or mouth have been exposed to any splash of the fluid. Wash the skin with soap and water. And don'ts. Do not panic and do not put the pricked finger in the mouth or do not squeeze the wound. Do not use the bleach, chlorine, alcohol, betadine, iodine or other antiseptic detergent. And I would like to say that कि जैसे नीडल स्टिक इंजरी किसी को भी हो जाती है, आजकल बहुत सारा स्टाफ डायरेक्ट माइक्रोबायोलॉजी लैब में आ जाता है रिपोर्ट करने कि हमें नीडल स्टिक इंजरी हो गई है. तो आपको ये कम्युनिकेट करना है कि जब भी किसी को नीडल स्टिक इंजरी होती है एज अ वर्किंग आवर 8 to 4, देन स्टाफ को रिपोर्ट करना है मेडिसिन ओपीडी में. मेडिसिन ओपीडी में वहाँ पे कोई भी होगा, स्टाफ होता है वहाँ पे आरटी क्लिनिक में, वो आपको फिल करके देंगे एक फॉर्म और उसमें ही इन्वेस्टिगेशंस लिखी होती है. एक फॉर्म फिल करते हैं, उसके बाद आपको जो टेस्ट करवाने हैं, कोई भी अदर हेल्थ केयर वर्कर्स है जैसे हाउसकीपिंग हो गया, उनका फ्री बिलिंग होता है टेस्ट का पूरा, तो उनको रिपोर्ट करना है. उसके बाद जो उनका फॉर्म भरेंगे वो आपको माइक्रोबायोलॉजी डिपार्टमेंट में देना है, मतलब वहाँ पे सबमिट करवाना है. क्योंकि आजकल किसी को पता नहीं है, वो कहते हैं कि उनका कंप्लेंट्स है कि हम घूमते ही रह जाते हैं, कभी ऊपर भेजते हैं हमें लैब में, कभी नीचे भेज रहे हैं. तो मैं आपको बता दे रही हूँ कि हमें क्या करना है, डायरेक्टली उनको मेडिसिन ओपीडी में भेजना है. अगर वर्किंग आके बाद में होता है तो एमरजेंसी में जाना है डायरेक्टली. All the percutaneous or mucocutaneous injury in healthcare setting, wash under running tap water for 3 to 5 minutes and do not squeeze or stir. Inform immediate supervisor, report to medicine OPD or emergency non-working hour. This is all about my topic, biomedical waste management and needle stick injury. If you have any question regarding this, you can ask.
ART is available at night time?
No, working hours, sir.
Only working.
Yes.
No, in the vacancy it's available, I think so. ART. One dose is they give it, and
Yes,
for regular feedback they need to go to the next ART. Yes, sir.
Any question? Thanks. Next, I see Miss Prajita. Next session will take by the Miss Prajita regarding clinic and disinfections.
Good morning to all. So let's continue with the next topic, that is cleaning and disinfection. So what's the difference between the terms cleaning and disinfection? Or is it the same? What's the main difference?
Anyone? What's the main difference? Cleaning, disinfection, and sterilization.
Sterilization will clean the microorganisms as well as the spores that are present in the surfaces, and this infection में only the microorganisms are cleaned. And for cleaning, generally जो visible dirt or pieces or like dirty skin हो गया, so that we use clean.
Okay, good. So in simple terms, cleaning means it's the physical removal of all foreign materials, including dust, soil, and organic materials like blood, secretions, excretions, and microorganisms. And disinfection means it's a process that eliminates many or all microorganisms except the bacterial spores. And sterilization means removal of all microbial life, including the spores. So since it is a broad term, we can discuss it under 3 headings, that is environment cleaning, cleaning and disinfection of instruments, then linen and laundry management. So regarding environment cleaning, we can divide it in 3 sections, that is cleaning of high-touch areas, low-touch areas and cleaning of floor. So first regarding cleaning of high-touch areas. So what is meant by high-touch area?
Anyone? What do you mean by high-touch area? Yes?
So the places where many people used to touch again and again, like our lab systems.
So any common one was the system, and apart from that?
The patient surroundings, the table also is a cardiac table. Like
Okay, cardiac table and? Yes, and?
Files, patient files also.
Patient files.
Okay. So high-touch areas means the areas which are used more. So in a patient setting, it includes patient's bed, mattress, side rail, cardiac locker, bedside locker, cardiac table, cardiac monitor, infusion pump, ventilator, IV stands. And when we come to nurse station, it includes the table, chair, then printer, monitor, telephones, the door knobs, all this. So this picture is representing all the high-touch areas in a clinical setting. Okay, so what about the cleaning of these high-touch areas? Which is the preferred solution that is to be used?
So high-touch areas, like as she mentioned that this contains metallic items. So what is the?
For metallic products, it is 70% error.
Okay.
And for non-metallic surface?
1% hypochlorite.
1% or 0.1%?
0.1%.
Okay, so in high-touch areas, we have to do cleaning at least once daily, and in critical areas, we have to do every 8 hourly. And for cleaning, if it is a non-metallic surface, we have to use 0.1% hypochlorite, and if it is metallic surface, 70% isopropyl alcohol. Then how to prepare 0.1% hypochlorite solution? If you have to prepare 1 liter of hypochlorite solution, what's the dilution? How much?
What is the strength of the hypochlorite that is provided every year in the hospital? 5%. Yes? 5%. Okay. So if you want to, as Rajita said, if you want to prepare 0.1%, so what is, how much? 1:2? So which formula do you use?
To find it out, you can use the equation C1V1 equal to C2V2. So in order to prepare 1 liter of 0.1% hypochlorite, you have to take 980 ml of water and 20 ml of hypochlorite solution. So for all non-metallic areas, you have to use 0.1% hypochlorite solution. And in case of terminal cleaning, you have to use 1% hypochlorite solution. That is, in order to prepare 1 liter, you have to take 800 ml water and 200 ml hypochlorite solution.
What do you mean by terminal cleaning, as she mentioned? Terminal cleaning, see,
When patient gets discharged or discharged, then terminal is
okay, yes. And that hold, very much importance during the COVID times. Like it was so important.
So that's regarding the cleaning of high-touch areas. Then low-touch areas, the same solution can be used and it should be done weekly. Next, regarding floor cleaning. So for floor cleaning, you have to use triple bucket system. What are the components of triple bucket system? So as it is mentioned, 3 buckets are there. The first bucket should be contained with detergent solution. That is, if you have to make 10 liter, then in 10 liter water you have to add 50 gram detergent powder. Then the middle bucket should be with plain water, 10 liter of plain water. And in the third bucket you have to take the disinfecting solution, which can be either hypochlorite solution or phenol. So if you have to use phenol, the dilution is in 10 liter of water, you have to add 100 ml of phenol. And if it is hypochlorite, you have to use 0.5% hypochlorite solution for floor cleaning. So to prepare 10 liter 0.5 hypochlorite solution, you have to use 9 liter of water and 1 liter of hypochlorite solution. And Along with this, 2 extra buckets should be kept for the preparation of this hypochlorite solution, and always we have to make sure that proper dilution and concentration is maintained while preparing these solutions. And for cleaning you have to use proper techniques, that is the 8-stroke technique has to be used. The video is there in our AIIMS website. Then while cleaning, always clean it from a low touch area to a high touch area. So that's regarding floor cleaning. Next is regarding cleaning and disinfection of instruments. We can discuss certain instruments which are common in use in our areas. This stethoscope, BP cuff and apparatus, you have to clean it using 70% isopropyl alcohol after every use. And for thermometer, first clean it using detergent, then wipe it using clean water, then again wipe it using 70% alcohol solution. Then for injection trolley and dressing trolley, every day you have to clean it using water and detergent, and after every use again clean it using alcohol solution. Then regarding ambu bag, clean it using detergent and water. After that, disinfectant it using 0.1% hypochlorite or send it for ETO. Then for nebulizer, you have to soak the nebulizer piece in 70% alcohol or disinfect with 0.1% hypochlorite for a contact period of 20 minutes and rinse off it with water. Next regarding suction bottle and oxygen humidifiers. So here first you have to clean it using detergent and water. Then you have to soak it in 1% hypochlorite for a contact period of 20 minutes. Again you have to rinse it off with clean water, and always make sure never to top up with water when it is not in use. So in oxygen humidifier, which water to be used? Is it the tap water? No, we should not use tap water. Always make sure that you are using distilled water or RO water. Then regarding pulse oximeter and glucometers, you have to wipe it with 70% alcohol after every use. Then for stretcher and wheelchairs, clean it using detergent and water, and if it is contaminated with blood or body fluids, disinfect it using 0.5% hypochlorite solution. Then for furnitures and surfaces, based on the material, if it is metallic, clean it using isopropyl alcohol, and if it is non-metallic, clean it using 0.1% hypochlorite solution. And for computer and telephones, again isopropyl alcohol. So in short, all the high-touch surfaces should be cleaned daily, and if it is metallic, 70% alcohol should be used, and if it is non-metallic, 0.1% sodium hypochlorite should be used. And for low-touch areas, weekly once cleaning should be done. And for terminal cleaning, after cleaning it with detergent, clean it using 1% hypochlorite solution. And always make sure that before doing disinfection and sterilization, cleaning is done. So that's all regarding cleaning of instruments. Next is do's and don'ts in hospital, that is linen and laundry management. So soiled textiles may be contaminated with pathogenic organisms. So if they are handled, transported and laundered in a safe manner, the risk of disease transmission is negligible. So do's in laundry, always keep the laundry in its designated area, and linen should be kept in a clean area. Don't place soiled linen on floor or don't mess it up with clean linen, and always keep the infected linen in yellow bins. So the key principles for handling soiled laundry include: do not shake it or use it in such a way that it is not aerosolizing any infectious organism, and make sure that it is not touching your body or clothing, and always collect it in the designated bins. So this is the flowchart representing the management of linen in our ward areas as well as the laundry area. So first we will see how is the management in ward areas. So the collection is done by hospital attendant. Then we will categorize it into two, that is soiled only and soiled means visibly soiled or infected. So if it is soiled only, if it is used only, what we have to do is collect it in the laundry bag, then count it and hand it over to the laundry staff. Then what's the difference between treating infected linen than the used only linen? Something additional to be done if it is used and soiled or if it is infected. What is that? We need to do pre-treatment using 0.1% hypochlorite solution. Okay, so let's continue with the topic. If it is an infected linen, first we have to do pre-treatment in our own area using 0.1% hypochlorite solution. After that, it should be collected in yellow polybag and should be properly labeled. Then after counting, we have to hand it over to the laundry staff. So these are the processes taking place in our clinical area. Then let's see what is happening in the laundry area. So in laundry, first they will receive the linen. Then again, they will categorize into two. They will see whether it is infected or not. If it is not infected, what is happening is it will undergo washing process and drying. And if it is infected, first sluicing will be done. That means it will be treated. Just last slide. So it will be treated under a stream of water. After that, barrier washing will be done and drying will be done. And the remaining process is same for both infected as well as the normal linen. That is, ironing will be done either using hand ironing or using a steam bed. After that, calendaring is done. That is for this bed sheets, calendaring is done. That is the final process which is making the linen smooth. It will be passed through the rollers under a specific temperature and pressure and will make it smooth. And finally, this clean laundry will be issued to the specific areas. So this is the management for laundry in ward areas as well as in the laundry area. So in short, the management of linen is, if it is clean, you have to store in a clean separate area. If it is used but unsoiled, clean in our separate green color laundry bag. If it is soiled, then clean it in after pre-treatment, store it in the specified designated yellow color bin. So that's all regarding cleaning and disinfection. If you have any queries, you're free to ask.